Hello, everyone. This is Xanda Hilger, and I coordinate the North Central Texas Area Agency on their behalf, Area Agency on Aging, the Caregiver Teleconnection. Today's speaker is Shelly Young, a very well-respected and valued colleague of mine for many years now. Shelly is the Program Manager of Diversity and Inclusion, and I would like to ask her, once I give you a little bit more of her credentials, to tell us what all is included in that job. She does oversee the education component, has a lot of experience doing Alzheimer's and dementia education, but also Shelly has a master's degree in gerontology and has been in the field for quite a few years. She also was her father's caregiver for several years. So Shelly, take it away.
Yeah, thank you so much. I'm just appreciate the opportunity to be with you today. So in my role with the Alzheimer's Association, I do oversee some of our support groups, education programs, and more recently, the Alzheimer's Association has always been concerned about anyone affected by Alzheimer's or related dementia. But in more recent years, they have really started to focus a great deal more on really just respecting the diversity of the people that the disease impacts and the caregiver challenges. So it's been really exciting to see the association grow our work in the DEI world. The changes have been quite visible in terms of the staff that we've added at a high level, including in our medical and scientific department. And then also even a focus with DEI on our national and local boards. So I'm really pleased to be a part of that. I feel like a lot of companies say they say they're going to focus on DEI, but they don't always follow through with what they say. So I'm very thankful for that. So the Alzheimer's Association our vision statement is to create a world without Alzheimer's and all other dementia. And so I want to just draw your attention to this because even though we're the Alzheimer's Association, we serve people no matter what type of dementia they may have, or some people never receive a diagnosis, but that doesn't mean that we're not there to support them. So I always like to make that clear. And our mission statement is that the association leads the way to end Alzheimer's and all other dementia by accelerating global research, driving risk reduction and early detection, and maximizing care and support. And so we are the largest private funder of Alzheimer's research in the US. And then in more recent years, since I had been with the association, they've actually tweaked our mission statement to include driving risk reduction, because there are some things that we know that can really benefit our heart and our brain. So we want to help people on that journey and to encourage them to engage in those activities. We cannot say at this point that we can prevent Alzheimer's or related dementias. There's mounting evidence that supports the benefits of a healthy lifestyle as it relates to cognitive health. So I apologize, this slide is actually old. We just updated our facts and figures document in March, and I didn't realize that I hadn't updated this. So what we know right now is that more than 6 million people in the US currently have Alzheimer's specifically. And right now the estimate is about 6.7 million. And then I also like to draw your attention to, there's a statistic right in the middle. And this one I think really blows people away because we hear so much about breast cancer and prostate cancer, but Alzheimer's disease kills more people in the US than breast cancer and prostate cancer combined. And I think that's kind of a shocking statistic. So this is my why, the reason that I do this job and that I come to this place every day is because both of my parents actually were impacted by dementia. My mom had Alzheimer's disease for 10 years, and she lived in a care facility. Some of that time, my dad was her primary caregiver. And then my dad suffered a traumatic brain injury. And then as he was recovering from that, then it became very evident that he also had dementia. And so eventually we were told that he had Lewy body dementia, but also vascular dementia, and vascular is related to strokes.
Shelly,
Yes.
what I'm seeing on my screen right now
Mhm.
is not the slide presentation, but the
Oh,
individual slides. I see the first slide.
oh my goodness.
Let me unmute a couple of people and let's see if it's just my problem.
Okay.
How about Minerva, what are you seeing?
The main slide that says, thank you for
Right.
joining.
Right.
Oh, wow. Okay.
Sorry about that.
Yeah, that is strange. So I guess I'll tell you what I'm going to do. I'm just going to stop
Okay.
sharing for a minute.
Okay.
I'm so sorry about that.
Don't worry about it. I thought it would catch up. That's what we saw. And I thought, well, once she starts, and once you made a change in slides, it didn't change on my end. So
That's kind of
sorry
strange.
to interrupt.
Yeah.
There we go.
Oh, wonderful.
There it is.
Okay.
We're
Wow.
good. Thank you.
Okay. Well, this is the most, we'll go with this. So these are my folks. Mom had Alzheimer's. Dad.
Shelly, kind of lost you there.
Am I with you?
There you are.
Oh, that was weird.
Hey, a few little glitches. It's a Monday. That's all we say.
It is a Monday. Okay, so let's try. Do you see?
We're
Yeah.
good.
Okay. Wow. I don't usually have too much trouble with Zoom.
There's
So
a box at there. It went away. We're good.
okay, good. All right. Okay, so that's mom and dad. They both had dementia. I also just like to draw attention to this photo because at the point that this photo was, my mom was probably 8 years into her diagnosis. And if you had just passed her maybe on the street or just glanced at her, you wouldn't even necessarily know that she had dementia. And I think it's important to note that because it's something that, the brain is being destroyed. The brain is literally dying, but you can't see that on the outside. So I just changed slides again. Do you see the change?
We're
Okay.
good.
All right. So I think there's benefit to talking just things that can cause memory loss and can mimic dementia or cognitive decline. So it is important, when a person is starting to show signs of decline, that we look at several different things and understand that there could be something other than dementia, but we know poor nutrition, also if medications are not being taken properly, or sometimes just a side effect of can be confusion. We also know excessive alcohol use certainly can affect memory. And then one of the things that physicians will typically assess for if a person is appearing to have cognitive problems is depression and grief, because that can absolutely mimic dementia. Infection, urinary tract infections are notorious for causing confusion. When I worked in a care facility many years ago, we had a resident who just woke up one day. She was acting in ways that weren't normal for her. And her family took her to the doctor. And they were
Not me. Shelly.
Am I with you?
You're there.
That is so bizarre. I promise y'all never
No,
have trouble.
Not a problem.
I
Not,
never
I
have
think,
trouble.
folks are very forgiving.
That's a good thing.
And I don't know of anybody who hasn't had some
Yeah.
internet or
Okay,
problem.
don't
Good.
think you don't, do you see my slides again?
We don't see your slides. We see
Oh,
we see the gallery view.
okay. Do you see my slide now?
Yes, we're seeing not the presentation view,
Right.
but the individuals. Okay.
Yeah, it's being slow. There we go.
Mhm.
Okay.
You
All
got
right. So we talked about some of the different causes of memory loss. So the most commonly asked question that I get is, what is the difference in dementia and Alzheimer's disease? And so first of all, I like to define dementia. So it is a general term for loss of memory, language, problem solving, and other thinking abilities that's severe enough to interfere with daily life. So I often have people ask me, even people in their 40s and 50s, like they're worried about dementia. Do they have dementia because they're forgetting things? And for most people, that forgetfulness is just benign forgetfulness. So I think one of the keys to this definition here is that it's severe enough to interfere with daily life. We all suffer benign forgetfulness. I have driven past my own home, mainly because I was distracted.
Sure.
Maybe it was dark and the weather was kind of funky or cloudy. So, I mean, we all do those things. Yes, we walk into rooms and forget why we went in there, but that is not necessarily dementia. It's when it starts to interfere with daily life. So I like to tell people that looking on the right side of the slide, it's all these different diseases or conditions that cause dementia. So Alzheimer's causes dementia. Lewy body disease causes dementia. People with frontotemporal dementia, that is actually caused by the pathology in the brain. And one of the symptoms of it then is the dementia. So dementia is the condition or even a syndrome, but it's these diseases or illnesses that cause it. We know people who have Parkinson's disease will sometimes, but not always, develop dementia. So all of these different things can cause dementia. So what are some of the signs of that could indicate that a person has dementia? So again, memory loss that disrupts daily life. One of the symptoms we saw with my mom was even pretty early in, she was repeating herself over and over again in the same conversation and had no memory, just even within those last couple of minutes that she had just repeated herself. So that was very disruptive, at least for our family. Also challenges in planning and problem solving. Sometimes clients will report to us that they noticed in their loved ones that they weren't able to do something like balance a checkbook, which is not just balancing the checkbook then that becomes problematic, but like the person's inability to pay bills and kind of do some of those basic things that need to be done. Difficulty completing familiar tasks. I've seen this manifest in washing dishes or taking a shower or brushing teeth, in that the individual is not remembering soap or toothpaste, or they're missing a step. Actually, that happened with my mom with her toothbrushing. And it turned out that she was going into the bathroom and brushing her teeth, but she wasn't using toothpaste. We also see a confusion to time and place. And this could be even somebody getting lost or confused in their own home. This one manifests a lot when you see the silver alert on the freeway because a person has gotten lost. Maybe they're going down the street to the church or to the grocery store and they end up in Oklahoma. And so that is sadly pretty common. And so it also makes it unsafe for people to be driving at a certain point, not necessarily early, but we certainly see that as things can progress. An individual with Alzheimer's may have trouble understanding visual images and spatial relationships, and the peripheral vision can narrow at a more rapid rate for those individuals. And so, that again it's not safe for them to be driving because they're not able to really see or perceive how close they are to other objects on the road. We see that people will sometimes have new problems with words in speaking or writing. If you were to ask them, maybe hold up even a pair of eyeglasses or a coffee cup, they would try to describe it. In some cases, they wouldn't be able to just recall coffee cup, but they might describe it to you. And then misplacing things and losing the ability to retrace steps. This is where it's different from what most of us experience. They're not able to go back and kind of sequence. If I come home and I walk in my back door and then a couple of minutes later, I can't find my keys, but I know I had to have my keys to open the door to get in the house. And so I can usually kind of backtrack and figure that out. But a person with Alzheimer's is most likely not able to do that. Decreased or poor judgment. One of my favorite examples of this was a client many years ago. Her mom had Alzheimer's, and mom lived out, in a rural area, kind of out in the country, was living alone. And mom purchased a side of beef. And if you've ever seen a side of beef, it's huge. It's pretty much a half a cow. And mom, it made sense to mom. It's also very expensive, but she had no need for all of that beef. She lived alone. She wasn't preparing meals for the ranch hands or anything like that. So that to me is a great example of that poor judgment. Withdrawal from work or social activities. Certainly we saw this with my mom. She had gone to the same church for most of her life and had always been involved in church and social activities and went to ladies' Bible class every Tuesday at 10 o'clock, and she stopped doing that. And I think it was just no longer comfortable or enjoyable for her. And then sometimes you can see a real change in a person's mood or even personality. Sometimes you have individuals who have always been really kind, and all of a sudden they can be really grumpy, even mean, start cussing like a sailor. And interestingly, all that is just sometimes par for the course for a person who has dementia. So what is Alzheimer's disease? The reason you hear so much about it is because it is the most common type or cause of dementia. It is a progressive brain disease that destroys brain cells. There currently is no cure, and it is considered to be a fatal illness. There's no single cause known at this time, but obviously a lot of research is happening. What we believe and what we typically see if you were to look at a Alzheimer's brain on autopsy is you'd see the presence of what scientists refer to as plaques and tangles. And those plaques and tangles are actually an abnormal buildup of a naturally occurring protein. And so for some reason in the Alzheimer's brain, those the proteins just start to build up and then cause the brain cells to die. And we don't know why that is. The single greatest risk factor is advancing age. But certainly, there are families where there seems to be a strong familial link, and you may talk to someone who's parent and all the parents' siblings had Alzheimer's. So it definitely is a risk factor. What they typically say related to family history is that it is a risk factor, but not a predictor of whether or not you will actually get Alzheimer's disease. And I just think this is a really interesting photo. Obviously, the brain on the left is a healthy brain, and then the brain on the right is an Alzheimer's brain. And so you can see there are color changes, and the size is greatly changed. And then even just the ventricles are a lot bigger. It's just kind of almost like, even hopefully you can see my cursor, but like the whole, so to speak, is just like a whole in function or ability. So what is the proper process for getting a diagnosis? So sorry. Am I still with you, Xanda?
Yes, you are.
Okay. We encourage, in a perfect world, the best practice is when you start to see changes in yourself or a loved one, that you would find a physician who is skilled in diagnosing all the different, I should have put neurological illnesses there, not dementing sounds so severe, but like with my family, what worked well for us was that my parents had seen the same primary care physician for many years. And so my dad took mom to this physician. He knew them well, and he just did some general assessment there in the office. He did use a tool called the mini mental status exam, where he just analyzed, or it's a 30 question assessment, and it can help determine if there are some cognitive problems there. It is not really a diagnostic, like it doesn't do the diagnosing, but it can help you assess if you need to do further tests. And so I believe on her MMSE assessment, she scored, I want to say like maybe a 25. And then also the doctor that day did assess her for depression, because again, remember in one of our early slides, we talked about the fact that sometimes depression can mimic dementia. An individual or a physician should also review the medical history and ask, is there a history of dementia in this family? And then again, I already talked about the evaluate mood and mental status, to do a good physical exam and diagnostic tests such as urinary, like a urinalysis, to make sure there's no infection going on. And then typically after some of these other things are done, then a person is referred to a neurologist for a neurological exam. And so all of these are really just tools in the toolbox to start to assess. It is still in some ways a process of elimination to get a diagnosis. But the good thing about some of these things is if your loved one had a urinary tract infection, that's treatable. If a person has depression, that's treatable. And so we really want to do a thorough assessment to make sure that there's not something else going on that is treatable for the individual. So again, back to my mom, we took her to the primary care physician. He was very thorough in how he assessed her and then referred us to a neurologist. It is not necessary to go to a neurologist, or in some cases, the referral may be to a psychiatrist or a geriatric psychiatrist, or to another professional. I also find there's a great value, and there are some good clinics, at least in the Dallas-Fort Worth area, that staff with geriatricians. And so typically, if you were to see a geriatrician, they would not need to refer you to a neurologist, because they are generally skilled in diagnosing the cause of the different types of dementia. But one of the reasons the best practice for early detection is then it just gives you time to plan. And the person with the diagnosis can be an active partner or participant in long-term care planning. It allows you to develop a strong relationship with a healthcare team. And then also the legal and financial planning can be really beneficial and reduce stress. Because you can sit down and have these conversations and talk about who you want to make decisions in the event that you're no longer able to, and what that would look like. Again, it allows you to grow a support system. And then there's also, I think, benefit for the person with the diagnosis and the family if you can educate yourself. And honestly, I think in some cases, this is going to sound a little corny, but I feel like education, it can be as beneficial, if not more so, than medication in some respects. Because if we learn how to interact with folks who have dementia, instead of always trying to medicate a behavior, that can be to their benefit. So what are the FDA approved medications? So typically it's the first three all act in the same way. So a person should not be on those top three. They should be in an early stage. Once they're diagnosed, they should be on one of those. And then Namenda, this fourth one down, is typically added as a person moves into the more moderate stages. There is also this medication called Nemzaric, and it is a combination of donepezil or Aricept and memantine or Namenda. And so sometimes people like that just because it means one less pill. It's a combination of two of the Alzheimer's meds. And so it just means that you're not having to take quite as many. And then again, it looks like it's been a little while since I updated this slide, but Aduhelm is a medication that was approved in the last couple of years by the FDA. And then there is a new one that very recently received approval called Leqembi that I don't have on this slide. So those meds are showing promise, and they're considered to be the first disease modifying meds. So the meds that have come out really over 20 years ago, which is these top meds, they're not considered to affect disease progression, but they can help with symptoms. And so kind of think of it like this way, you know, for instance, if a person has arthritis and they take a pain med, that pain med doesn't make the arthritis go away or necessarily affect disease progression, but it helps with the symptoms. And so the Alzheimer's meds are the same. But when we get down here to Aduhelm and then the new med called Leqembi, those actually are disease modifying. And so some of the people who have participated in those drug trials and taken those meds actually report a greater quality of life and greater clarity over a period of time. And so we're really excited. There's some other meds in the pipeline that are similar and that also are considered to be disease modifying meds. And so we're really hopeful. One of the primary reasons that we're not seeing a lot of people able to take the new meds at this time, one is just the cost. And also thus far, Medicare has chosen not to cover them. So that could be a whole other probably hour-long program for another day just on the meds. So Xanda, maybe we'll do that another time.
I heard it. I already making a note. Thank you.
Yeah. So how do we stage it? When I first started with the association 15 years ago, we would break Alzheimer's into 7 stages, but truthfully, nobody fits cleanly into any one stage. And so typically in the mild stages, what we're really seeing is, especially with Alzheimer's, a lot of the forgetfulness, The person may be trying to cover it up. You may also see some other changes just around the house. They're not able to manage things as well. Could see changes in social behavior. Then as a person moves into the more moderate stage, certainly we see the impacts to their cognitive function, but this is also when you really start to see changes in their personal care. They may have a much more difficult time. For instance, even just taking a bath, remembering to take a bath, doing some of the things around the house that they need to do. So all of these things will continue, but then and continue to worsen over time as well. And then by the time a person reaches the late stages, just that disorientation and confusion is severe. You potentially will see a lot more anxiety and agitation. And then honestly, one of the hardest things to deal with in late stages, and really even in the moderate stages, is incontinence. And I actually, in the time I've been with the association, and just too with my dad taking care of my mom, a lot of times it's the incontinence that kind of pushes the caregiver over the edge and allows them to make a decision to move a loved one. Because like with my dad, my mom was incontinent, changing diapers multiple times a day, but then the incontinence at night became really difficult to manage. And he was sometimes changing the bed sheets twice during the night because of incontinence. And it just, he was in his 70s. It was just so very taxing and exhausting to manage that. And so that was kind of the icing on the cake and the tipping point. But I've heard lots of other folks refer to that too. So I think, Xanda, how about we we're doing great on time. So I'm going to stop sharing and see what questions people have related to what we just talked about.
Okay. I'm going to unmute. All right. Who has a question or comment, including your own experience with this?
Absolutely.
While people are gathering their thoughts, and if you want to put it into chat, if you want to put your question into chat rather than ask it live, go ahead and do that and we'll read it off, and Shelly can do that. Shelly, a question that always comes up is, there's a problem, other family members know there's a problem. What are some strategies of how to get someone to let you take them to the doctor to talk about this?
And that is the $24 million question. I think, honestly, it's one of those things, if I could really answer that, I would be so rich.
Yes, you'd retire.
Yeah. And I would say too, just for future reference, the Alzheimer's Association does actually have a program called Dementia Conversations, and you can take it virtually. In a little bit, I'll drop that information into the chat.
Okay.
But you can, so getting them to the doctor. So one of the things is, it's really frustrating, but they're often, even in some of the earlier stages, it's not, for some people it is denial, but often too, one of the symptoms of dementia can be a kind of a lack of self-awareness. And so they don't know that they're not okay. So to sit down, you can try to sit down. I always recommend that first, and say, hey, I'm concerned. Can we get you to the doctor? Is always a good option. But if they're not aware that anything's wrong, then they may become really defensive. And so, some of the things that we even recommend that you do are it's okay to fib a little bit. It's okay to take them for an outing, by the way, take them to the doctor. Sometimes it's helpful to enlist the help of another trusted family member or friend, because they can put up a lot of roadblocks to families in particular. Family members. I do recommend that if you're already concerned about it being a difficult conversation and, your loved one getting, defensive about it, that you can even try to communicate with the doctor in advance. They may not, most doctors I think are fine with this. So I've encouraged people, to take some notes or even just explain in advance to the doctor via letter or fax or whatever. Even now, of course, most physicians have, their medical records portal where you can share information and they can share information back. But to give the doctor a heads up can be helpful. But those are some of the most difficult conversations you will ever have, especially if they're not aware of those changes. They can become very defensive.
Okay. Helpful. We have a question in chat. I've noticed that my mom refuses to eat much or hydrate well. Is this normal? I feel like if she was hydrating, she would be better, but I can't get her to do so. She is maintaining a healthy weight, though.
So that is a great question. And it is very common for people with dementia to not eat well, and often weight loss is an issue as well. Thankfully, it sounds like for Terry, that's not so much the case, that she's maintaining a healthy weight. But we encourage people, just whenever you think of it, encourage them to take a sip of water. Maybe if they don't like water, even to add a little like even some fresh fruit or a little squeeze of lemon to flavor it up. I think even, like, I can give you an example. It appears that for many people with dementia, like their body is just not sending in them messages. And so to give you that they're hungry or they're not hungry. And so to give you an example that happened with my mom, I remember so distinctly, it was a Sunday afternoon. My brother and his family were in town. We'd all sat down, had a big lunch after church on Sunday, and then everybody got up and we cleared the table and had all gone up and done our different things. And my mom was still sitting at the dining table. So after this big meal, I walked back through the dining room a little later and she said, "When are we going to eat?" And so that to me was like the most perfect example of her body just not giving her the right messages. She didn't remember we had eaten, but because she was sitting at a table, that was a visual cue to her that it's time to eat.
Right.
So, we even encourage just like keeping even some simple healthy snacks around, and, fruit can be a good example of that, and just some things that might encourage them, and just offer it frequently. Just offer it and do the best you can. Also, of course, they do this in like assisted living and nursing homes, but they will put a lot of calories into whatever food an individual is eating. So, a lot of times we certainly, especially for, people who are somewhat younger, we're not encouraging you to, for me, I don't need to add butter and a lot of salt and a lot of flavoring to the things that I'm eating. But for an older person, sometimes it's okay to really try to put a lot of flavor and a lot of calories in to what they're having. I hope that makes sense.
Right. Good question, Terry. And Karen is asked, or is stated, she's having a hard time figuring out depression / forgetfulness versus dementia. Cognizant that they are aware that they are forgetting things and still able to do ADLs. That's activities of daily living for those of you that weren't familiar with that. And she is taking Prevagen.
Yeah. So one, I've heard this before. This is kind of semi-medical advice because I heard it from a very skilled medical professional. But she says that when she's in with a patient and trying to assess them, one thing that she notices is if she asks a person with depression a specific question or asks them to complete a task in that appointment, she said if they have dementia, they will try. Now they may not successfully complete the task or answer the question, but they will try. And she said a person with dementia or with depression won't even try. So Xanda, I don't know if you've heard that before.
No, I hadn't.
Yeah. And so again, that's not really medical. But that can be a good example because people with depression are just often so apathetic and
They don't care.
don't care. Right. And so that might be a simple tool. But I would say, I mean, if you suspect that something's wrong, now I don't know that there's any harm in taking Prevagen, but I don't think Prevagen is going to fix anything if you really suspect that there is some true cognitive decline happening. Yeah, but always just talk to the doctor. And if you have someone who is unable, or you're having a hard time getting into a doctor or can't find a doctor, I would encourage you to call the Alzheimer's Association. We have a 24/7 helpline. In fact,
that was my next question, actually. And by the way, Karen says, interesting. She hadn't thought of that and makes sense. Thank you for that.
Yeah.
And that was a question I was going to ask too, is we do have people from all over the country
right
that are listening in. And so having that helpline and the Alzheimer's Association would know the physicians in their service area.
Yeah, the helpline is really a great tool. And it's answered 24/7 because caregivers' jobs never stop. And so we always want people to be able to get the care or the help that they need. Certainly we have people with dementia who call the helpline, but we also have, it's primarily a resource for people who are caregivers. And so like my dad, when my mom was, wetting the bed multiple times a night, then, he could have called that helpline in the middle of the night to see if they could answer some questions or maybe had some suggestions for him. So the people that staff the line are care consultants, and they can really offer substantial support. In fact, I'll tell you what, I'm gonna share my screen again. Are you seeing it?
Yes.
Okay.
Well, now it's
right. Yeah. My screen. It's just not
sure. We can see it though. We can see what's on there.
All right. So I'm going to jump forward. Here is information. And again, I will share with Xanda my slides after the program. But so the 24/7 helpline is one of my favorite tools. Just because you can use it anytime, and people call it for a variety of reasons. They call for assistance finding a physician, or just not even sure what the process for getting a diagnosis might be. But I mean, I can't even tell you when I've talked to people, they've called. We had a situation years and years ago where the helpline got a call because this man was living in a care facility and he was spitting all the time. He was engaged in just this repetitive, habitual spitting. And so we talked about how they might solve that with gum or wearing a mask or some different things. So we get such interesting calls. Had a call one time from a lady whose husband had started urinating in the kitchen sink and not the bathroom. And so again, we talked through some of those challenges. We also have people who call us because they just literally are at their wits' end and they just need to talk. They need to vent. So really encourage you to use that helpline. Also, we have education programs such as the one today, but we also have an on-demand e-learning portal, and you can visit alz.org and get all sorts of information. But those e-learning classes, again, we have one on dementia conversations that might be helpful, that talks about how to get your loved one to go to a doctor appointment. Also, you'll notice over here our community resource finder. I personally use that tool all the time because you can go in and search even for support groups.
No, we're not seeing that.
Oh, this is so weird.
I know. It's on healthy behaviors for your brain.
Oh my goodness, it did not. So I've been
just advance to that one. You don't worry about the slide view. If we can just.
But I am advancing. I'm seeing something different.
Oh,
That's
yeah.
the problem, is that what I'm seeing isn't what you're seeing.
Apparently.
Okay, so let's do this again. I'm going to stop sharing for just a second. And now I'm going to share again. Do you see how we can help?
Yes. Yes.
Okay, great.
Got it.
That's where I was. Okay, so again, there's information on our website. Has all sorts of education on different topics, but also then you could use the e-learning portal. But then over here is the community resource finder. And so if you maybe you're joining from another city or state, but you want to help a friend, you can go to community resource finder, and it allows you to search for things like in-person education and support groups. You can sort then by city or zip code. So you can get information on programming that's not even in your area. Maybe you have a friend or loved one in a wholly different city. And
that's a very valuable site also, because with the advent of all of this online learning,
yes,
you can get some really outstanding programs that aren't anywhere. They're on the other side of the country.
Right.
And these programs, most of them are free. Matter of fact, I don't think I've seen any of them yet that are a fee-based.
Right.
Because most of them are sponsored by the Alzheimer's Association. May I ask, Terry has asked a question. Is there an average number of years of life for somebody with Parkinson's and dementia? Does it progress quickly? And then Karen replied, yes, it is progression, gradual or rapid, to be able to know when it's time to consider assistance. Refuses leaving home and living with me, has that safe haven. So got a couple of different issues and similar.
So related to the lifespan and how quickly things can progress, especially with Parkinson's, I don't know. I'm sure, and I think there even are. I think Parkinson's actually has like a national association or foundation. And I think if you just Google them, you would easily find kind of the basic information and stats. With Alzheimer's disease right now, I think they say that average lifespan is around 8 years for a person once they've been diagnosed with Alzheimer's. And then I'm going to pull up, well, let's see.
And yet, is it true, Shelly, that even though it may be diagnosed 8 years out, it's been developing for many years prior to that?
Yes. So that is a great question. So what they believe right now, specifically with Alzheimer's, is those changes that are occurring in the brain may start as much as 15 or 20 years before we see the onset of symptoms.
Mhm. And Karen's saying, wow. Comment, wow.
Which is why the Alzheimer's Association now is so actively supporting education on healthy living,
Mhm.
because
Mhm.
there, like, if that's the case, then we need to be embracing healthy living now in our, early 40s, 50s, so that we potentially can impact this progression.
Mhm.
Mhm.
Shelly, a question I have, I've been both out in the world as well as some of the professional things that have come across my desk. This
Mhm.
discussion about, is Alzheimer's a new form of diabetes? Not a new form, but it also is a diabetic diagnosis.
I
Is
don't
there
really
enough on that yet?
hear, I mean, not that I've never heard that, but I don't hear a lot about that generally. And I think honestly, I mean, so one of the things that our education programming around healthy living covers
Mhm.
is that we want to look at this in a very holistic fashion, and we want to encourage people to just engage in a healthy lifestyle and
Mhm.
control what you can.
Yeah.
So I mean, they definitely don't jump to, like, I've even seen information in headlines, that Alzheimer's is actually type 3 diabetes and all kind of sensational stuff. So 100%, all the things that we know that affect our health can put us at higher risk.
Mhm.
So controlling all of our numbers, controlling blood pressure, blood sugar, cholesterol, all those kinds of things are very beneficial. And again, we have on our e-learning portal and even live, we have some education around healthy living. We have a program called Healthy Living for Your Brain and Body. And so it just covers some really basic stuff. But what I say is just be intentional, control what you can, do the best you can. And so, I mean, certainly diabetes factors in, or it is one of those things that potentially we can control.
But there really is nothing, it's more just anecdotal and just more, there's not enough evidence that
No, they certainly, people in the true Alzheimer's research and treatment world are not and have not considered like Alzheimer's to be type 3 diabetes.
Okay, Karen wants to know, what about the new mind diet that she's heard of? Can you address that?
I can't really. I think that is one actually, though, that's even listed in our healthy living curriculum. So a couple of diets that are supposed to be good. Of course, the Mediterranean diet. We just know lots of fruits and vegetables. There's also another one that I can't think of the name of it, but it has to do with, again, a lot of fruits and vegetables and healthy oils, and also reducing the salt in the diet. But I'm pretty sure the mind diet is also one that is strongly recommended. So another thing that we have very recently added to the curriculum for our healthy living program is the importance of sleep and restorative sleep. So I would encourage you, if you have some time, in fact, I'm not good at doing two things at the same time. So I did, just, if you don't mind, by the way, I dropped in, there is a link that I dropped into the chat that says feedback.alz.org. If you would please complete that, because that allows me to get credit for today's program. I can count that toward my goals. So I would greatly appreciate that. But let me also jump over to the internet for a second.
And while you're looking for that, the mind diet, encourages consuming vegetables, berries, nuts, whole grains, olive oil, fish, beans, poultry, and wine. So it is similar to the healthy eating diets in the Mediterranean, but with a different focus, I guess. But apparently it was written to help protect against dementia.
Okay. For some reason, when I have Zoom
Mhm.
up, everything on my laptop is just slower.
Uh-huh,
Interesting.
very.
Okay, so I just dropped in the link to our e-learning portal, but it's got several different. Those are also good links. Like if you've got somebody who just can't, who maybe isn't even convinced that a loved one has
Mhm.
dementia or is just questioning legitimacy of a diagnosis, even those are some good programs that you can just share with them that they can view at their convenience that might be helpful.
And there is a comment about the feedback form. And if you do click to that, it takes you to another Alzheimer's Association page, because the comment was, can it be sent as a link instead of a photo? And what you dropped in is a link, not a photo. And I don't know how that's coming up as a photo, but it is a link to the survey.
You know, it actually looks like it, for some reason, it's in there twice. So the first one is the link and the second one, I think, is a photo, which is kind of weird. I don't know why I did that.
Well, I've opened the last one and that one, and
Okay.
it's coming up as a
Yeah.
survey. So anyway, try both, I guess is the question, is the best thing is. And if for some reason you're not, tell you what, can everybody now, could you go ahead and try to open that? And let's see, and if you're not able to, just make a comment in chat, and we can make sure that you get what you need. Because that's something also, Shelly, that we can send when they
Oh, sure. Thank you.
PowerPoint.
Yeah.
Mhm.
So I just dropped it in again.
Okay,
And it looks like it did send as a link this time.
it did.
Yeah. Okay. Great. Well, I know we're at time, so I mean, I can stay on. I'm happy to stay on for a little while if there's more questions.
Other comments or questions that anybody has? I have a few more resources that I can offer. Questions or comments? And then I want to share these with you. Okay, Karen said that the link worked to get to the survey. So a couple of resources, again, across the country, you can call, if it's, especially if it's Alzheimer's specific, the 1-800 number that Shelly provided, and they have one of the simplest URLs, which is alz.org. If there are other questions or community resources that may be outside dementia and Alzheimer's, 211 is across the country. It's a portal or front door to community resources. The area agencies on aging are frequent partners with Alzheimer's Association. And for any of these, just go to your favorite browser and drop in 211 or drop in area agency on aging. And it you should be able to get to a link that will help you find your local area agency on aging. They're across the United States. They are the federally mandated program for planning for older adults and caregivers and implementing certain programs. Our website is Family Caregivers Online, and we have an extensive resource directory, as well as Shelly and Alzheimer's Association has contributed to that. We have blog sites, we've got education. This is all taxpayer supported, so it's all free resources. The Elder Care Locator is another resource. It's an 800 number, and more frequently than not, the Elder Care Locator will direct you to an area agency on aging, or if you've been very specific, it'll send you to the Alzheimer's Association 800 number. But the Elder Care Locator is 800-677-1116. 800-677-1116. And what we like about that is when the window opens up, you just put in a zip code. So that's helpful too. Something called the Aging and Disability Resource Centers, ADRC. Again, this is one of those no wrong doors. You call one number and they can help plug you in to a variety of resources, because I'm sure that Shelly would agree, frequently there's not just one issue going on. There's also financial or legal or family issues. So that's what some of these resources are about. If you were, Shelly, if you were to summarize or close, what do you think is a significant piece of information that you want to get across to our listeners today?
Yeah. Oh, good question. I mean, I think one of the most important things is just to not wait to get help. You know, people just put it off, you know, like I don't need help yet, but you know, just to be educated means that you're armed, and to already start, if even if this is early stage for you and your family, to start, you know, trying to figure out who the key players are going to be in the team, the care team members, and to just start to prepare. But you're not alone in this. There are so many people out there dealing with this.
Okay, thank you, Shelly. Again, wealth of information, and it's just as you said, we could be on the phone or on Zoom another couple of hours and just scratch the surface of a lot of the issues that are going on.
Yep.
And I think that's a great idea. Let's talk about doing a session on medications. That would be very helpful. Thank you, everyone. Please take care of yourselves and listen in to all these valuable teleconnection. Thank you again. Bye-bye.